Welcome to the Voices of Otolaryngology podcast series, where we spotlight diverse perspectives and insights within the field of otolaryngology. I'm your host, Rahul Shah. Let's jump into it. Welcome to Voices of Otolaryngology. I'm super excited this morning to be with Dr. Dilger and Dr. Tummala. You're repeat guests. We've done about 55 of these, and very few people come back, but overwhelmingly, everybody wanted to bring you all back. So welcome.
Thank you so much for having us.
Yeah, you and your committee, the Sustainability Task Force, have really been carrying the flag and educating our members. So thank you on behalf of the members for what you're doing to help us understand sustainability in our practices. The goal today is to talk about our specialty. And last time we talked about what we can do as otolaryngologists, what we can do in our hospitals, what we can do in our operating rooms. Today, I'm really excited to go into specialty specifics. So who's going to kick us off?
I can start so I think last time we briefly touched on like some of the health impacts of climate change that we see in otolaryngology specifically, because a lot of the news around climate change, air pollution is focused on, health systems impact, access to care, cardiovascular disease, pulmonary disease, but there is quite a bit of data coming out that shows how things like climate change and air pollution impact our patients directly in otolaryngology. So we wanted to go through some of that literature and just see, where there's some opportunity for future research there.
Fantastic. I think back to my MBA, and there's something called a PESTEL analysis. PESTLE, PESTEL analysis, when you're looking at a situation. It stands for political, environmental, social, I forgot the T, technological, legal. I'll figure out the other E's later, but the most important to me is the environmental. And it's interesting that we think about that as a factor. Before we go too deep in the specialty, I wanted you to focus on the specialty, but give us a couple of top lines. As a doctor, as a healthcare provider, what are the impacts that we are seeing from climate change? Just Dr. Tummala, what do we see out there at a macro level?
So there's a lot of different things that we're seeing. And I think the challenge is we actually don't really know how much of an issue climate change is on our health. I think one of the hottest topics right now is heat. And 2024 was the hottest year on record. The last 10 years were the hottest year on record. This summer, Europe saw record heat waves. We still don't know how this year is going to compare to last year, but just that growing heat exposure is putting a lot of extra stress on, every organ in our body. And so heat is just one small component of it. It's one of the easiest to think about when we think about climate change. But it's just like thinking about how heat and then how that relates to worsening wildfires, how that impacts air quality, how the changing temperatures are affecting worsening hurricanes, and how that's affecting health access and personal trauma. Since moving to New York, I've actually, being in the Northeast, is one of the first times that I've really been talking more about Lyme disease with patients as well. And so there's an infectious disease component to this. And so I say all these things because there's so many different levels that we're thinking about with climate change.
That was wonderful. We try to record these all at once. It doesn't need to be perfect. So I'm embarrassed about the PESTEL. Let me get it right. Political, economic, social, technological, legal, and environmental. All right. I just want to make sure my MBA was valid. Dr. Tummala, that was a fantastic segue. You're right about the Lyme disease. Actually didn't think about it. I trained up in Boston, and we know that that's maybe a New England problem. But with climate change, if it moves north or south. Anyways, I completely get it. Thank you for that linkage. All right. I'm really excited. In our specialty, what are some disease-specific conditions that are being impacted by climate change? I'll let either of you take it from here.
I can start with some of the new studies that have come out looking at head and neck cancer specifically. So air pollution and specifically particulate matter 2.5. So that's really small particulate matter, smaller than basically the width of a hair, is known to be carcinogenic, particularly for lung cancers. It's been very well studied. And there hadn't been as much on head and neck until in the past year, even though the exposure mechanism is pretty much the same since we're breathing in the air pollution. So there were two studies that came came out this year, one out of the Center for Surgery and Public Health up in Boston when I was working there, and one out of Chicago, looking at the SEER database and how air pollution exposure links potentially to higher incidence of head and neck cancer, and both found an association between all head and neck cancers and exposure to air pollution, so higher incidence with higher exposure. We specifically looked at lag time, and we saw that after 5 years of an exposure, you were more likely to have a higher incidence of head or neck cancer, which maybe so that's kind of sort of trying to figure out like a pack year equivalent, which hasn't quite been elucidated yet with the research. But the longer term exposure does seem to be worse for folks in terms of malignancy risk. So that's one aspect that we've been looking into, and we have a couple more studies coming out on that as well.
That is so cool. I love hanging out with you both. I get smarter by the minutes. So really, really appreciate that's fascinating, Dr. Dilger. So I'm an otolaryngologist in a practice. How do I think about what you just said? Do I screen different occupations? Is my threshold for examining, through a flexible fiber optic scope, the upper air digestive tract lowered? How do you operationalize that? It's absolutely fascinating.
Yeah, I think that, it's just, I think we traditionally think smoking, drinking as the big exposure factors, but especially in urban settings, in areas where we know there's higher levels of air pollution, I think, it's important to take that into account too and consider that as a risk factor as well. It's also an important thing to consider perioperatively, since air pollution exposure increases risks of cardiovascular and pulmonary disease. So it may impact our patients' ability to safely undergo surgery. So I think that's another thing to take into account, is what's their exposure like on a daily basis? Is there anything that we can do to mitigate some of the exposure risks, like HEPA filters or counseling, things like that?
Awesome. I love it. So I take a history on a patient. We think about smoking. We think about alcohol exposure. But when you're talking about 5 years of dense urban air pollution exposure, you're saying maybe that's a question we throw out there, or maybe on the intake form, because then it raises our antennas that we need to think differently about this patient. Is that right?
Exactly. Yeah.
All right. Amazing. This is fun. All right. Keep educating me. What else do we need to think about climate in a practice? Dr. Tummala, are you up? This is
I'm
cool.
up. Yes.
All right. Go ahead.
So one of the big topics that I think about a lot with my patients is allergic rhinitis and how that's impacted by climate change. So there's been a lot of different studies that have evaluated how warmer temperatures and higher levels of CO2 are affecting pollen allergies. One of the most, I would say, substantial has shown that over the past 50 years, the length of the pollen allergy season in the US has longer by about 3 weeks. And there's about 21% more pollen in the atmosphere. And that just relates to increased CO2. We have more growth of plants and trees that produce more pollen. So when we think about the clinical consequences of it, I'll never forget, I did a talk with an allergist from Atlanta, and he joked that he used to tell his patients to start their allergy medications around St. Patrick's Day, and now he tells them to start around Valentine's Day, to account for that earlier start to the pollen allergy season, because we know that a lot of the intranasal sprays like Flonase take a few weeks to be optimally effective. And so similarly, with a lot of my patients, I'm telling them to continue their medications longer in the fall if they have bad ragweed pollen allergies, because the ragweed pollen may be sticking around longer than it used to.
You can just keep talking. I mean, I learned so much from that. That is so cool. Help me with the denominator. I'm a pediatric otolaryngologist, but I want to go back to the pollen allergy season increased by 3 weeks. What's the denominator? How long is the season? 20 weeks? What is it?
So that's a good question. I actually don't know the exact number of like what the season is. Because it would be accounting for like tree pollen to grass pollen to ragweed pollen.
Fair, good point.
And so there's two components to that. So one is that studies have also shown that because of the warmer temperatures, there's been more overlap of the pollen allergy season. So if someone previously only had like a tree pollen allergy, that might be lasting longer into the grass pollen season. And so there's a little bit more overlap. But the length of each pollen season itself, I'm not as familiar with.
Yeah, no, it's okay. I didn't mean to put you on the spot. No. Sorry. I'm getting some MOC questions through here, so I apologize. So let's think. You mentioned a 20% increase in pollen due to environmental factors, and you probably can explain it all day long, but just for members and myself, explain how how the environment affects increase in pollen to the best of your ability?
Sure. Right. So with warmer temperatures, trees are able to grow earlier in the year. So basically, the freeze-free season, the amount of time that the ground is thaw and that trees and plants can grow is longer. And so that's why, so trees are blooming earlier in the year because the weather is turning warmer earlier, and then ragweed is sticking around longer because the ground doesn't get cold and freeze as quickly. And so that's one of the main factors driving it. And then a second thing is, and we're seeing this with a lot of infectious diseases as well, with the changes in temperature and precipitation patterns, plants and trees are able to grow in new geographic regions. So sometimes we're also introducing new pollens into regions that previously were not hospitable to that plant or tree species. And so again, we're seeing this with infectious diseases. We're seeing this, it's a huge issue with like agriculture and hardiness zones, like where farmers are able to grow certain crops throughout the world, but also here in the US. And so basically there's just changes, it shifts, right? And so as clinicians, it's really helpful for us to be aware of these changes so that we know what is it that our patients are facing and how we might be able to counsel them on how to best manage their allergic rhinitis, how to best manage their pollen allergy symptoms moving forward.
Yeah, fantastic information. There's a stat that a significant majority of otolaryngologists end up practicing within a 200-mile radius of where they did training. All right, so that was a mouthful, but generally, what it means is we stay regional, which makes sense. And prior to the acceleration of the climate impact, you would learn a certain methodology. If you were in New England, you would know a lot of people come in with canal cholesteatomas or canal osteomas from swimming, right? Cold exposure to the ears. But now what you're saying is, look, in your lifetime, you might see an evolution. And you mentioned moving up to New York and maybe Lyme disease spreading out further or the impact of allergies. So it's incumbent on us as otolaryngologists, physicians, surgeons to be aware of these changes, right? Because what you learned in training in 20, 30 years, you might be treating a different spectrum.
No, exactly. And we saw this also this year and in 2023 with the wildfires in Northern Canada. So in 2023, I was in DC. This year, I was in New York. And both places, a lot of my patients came in and were like, my sinuses are flaring up. I'm having a lot more upper respiratory issues. And it was because the wildfire smoke from Northern Canada was traveling down into the Northeast region. And so these, again, wildfire smoke tends to be more of a regional thing in our minds, right? We're thinking about California and the West Coast, but this wildfire smoke can also travel thousands of miles. So there's the regional component. And then it's also thinking about, okay, so what is also changing because of climate change and how that's, I think, breaking down the regional walls and barriers and actually introducing new health impacts into areas that you previously would not really be thinking about New Yorkers dealing with wildfire smoke and how that's impacting their upper airway.
Another awesome example, and I'm also thinking of our colleagues up Rochester, Buffalo, near the Great Lakes. So then you add particulate matter, Dr. Dilger, using your words, of a certain size, you add humidity, moisture, and then it complicates the sinuses. Any special treatments, Dr. Tummala? Obviously, you thoroughly examine them, but any tricks, or is it is just management of acute on chronic sinus exacerbation? Any tricks you would recommend for some of those particulate exposures causing a flare-up of sinus?
Yeah, I mean, I think it's a combination of counseling the patients on awareness. I agree with Dr. Dilger on really being mindful about HEPA filters. The amount that I've been counseling my patients on optimizing their indoor air quality has really increased. I feel like every year that I've been in practice, really optimizing pharmacologic therapies in terms of like what works for that patient, what's going to be most impactful between like saline rinses, steroid rinses, and just using topical nasal sprays as well. But a lot of it is just, letting people know what's happening, and letting them know that masks do help. They are effective, especially to protect from air pollution and wildfire smoke. I think it is hard for people to get excited about wearing a mask outdoors anymore, especially when we have so much PTSD from COVID. But, those things can be helpful. And then, of course, there's the component of what's the driving force of all of this and how do we try to prevent this from continuing to get worse over the next 10 to 15, 20 years.
Dr. Dilger, sorry about that. I went on a tangent there, but I want to make sure I let you weigh in here if you want to take us to a different tact, Dr. Dilger.
No, that's okay. I completely agree with everything that Dr. Tummala said. The only other couple of things I was going to add with respect to the air pollution, we just know that plants are metabolizing differently because of the higher levels of carbon dioxide in the air. So that's also contributing to the higher metabolic rate in plants and the higher levels of pollen. So we can expect that to continue as the carbon dioxide.
Hold on, that's very astute. I mean, you said it so fast. Explain it one more time. I think it's really important. So plants are metabolizing faster because of higher CO2, which means they crank out more pollen.
Exactly.
All right, cool.
Yep.
Easy for a surgeon. I got it. That's fascinating. Fascinating.
Yeah. They did a bunch of studies early on plant metabolism in different like levels of carbon dioxide, different levels of heat to see how much pollen they generated. And so they saw like increasing levels of pollen with different levels of CO2. So that's another reason that, we're so passionate about trying to improve outdoor air quality and trying to reduce pollution so that we can hopefully scale back on all of this pollen creation. And then the other
Can I interrupt you?
This episode of Voices of Otolaryngology is brought to you by
If you struggle and struggle and struggle with CPAP, you should check out Inspire. No mask, no hose, just sleep. Inspire, sleep apnea innovation.
Can I interrupt? Sorry. Don't lose your thought. But it's also interesting because no longer is allergic rhinitis or allergies geographic. No longer are they seasonal. I think Dr. Tummala was saying they're kind of overlapping. And you're saying, Dr. Dilger, then they're like upping up as well in intensity. We're getting sophisticated with biologics and treatments, but Mother Nature is kind of beating us.
Yes, exactly. And I think, as Dr. Tummala mentioned, I think that counseling patients on exposure is important, especially, when we have folks that are working outdoors, telling them to wear a mask when possible. It's kind of the same as hearing protection for folks that are working out in construction and are out in the heat. Not always easy to wear a mask when it's super hot out, but, really important for protecting the upper airway from particulate matter. So that's something that I try to counsel my patients on as well.
I'm notorious for giving other people work to do and not doing much my own. Dr. Dilger and Dr. Tummala, let's not forget about that. We have position statements talking about hearing protection for occupational hazard. My antenna just, went up. You're kind of saying, let's think about upper air digestive tract protection in those that are in dense urban areas. If you're a construction worker in New York City on a 110-degree day, or Chicago or LA, right? It's really hard for those folks.
Mm-hmm. And I think also one area that's been talked about a lot is the firefighters who are fighting the wildfire smoke. There's been some back and forth as to whether or not they're supposed to wear masks, because I think some folks think that the masks impair their communication when they're out in the field, while other folks are focused more on the protection for the upper airway. So it's not super clean cut in terms of what they're doing. But I think, if we made recommendations from a specialty specific angle, saying that for protecting the upper airway they're recommended, I think it could be beneficial.
That's really interesting. The communication is the current day problem, but the impact on their upper air digestive tract from the pollutants could be 5 to 10 years, right? It's so hard. Do I deal with the communication now? And we saw that with 9/11, right? Unfortunately, we see that with our first line responders who are heroes. So thanks for bringing that up. Continue helping me think. What else do I think about as an otolaryngologist about the impact of the environment for my practice?
Sure. One, I touched on how the wildfire smoke is impacting sinus inflammation, and how I definitely heard that from a lot of my patients, but just poor air quality in general. There has been studies that have shown that increasing exposure to PM 2.5, which was the particulate matter that Dr. Dilger was talking about, increases the risk of chronic rhinosinusitis, and that risk increases with prolonged exposure. And so, we've touched on this a little bit. But it's really, when we think about it, there's like multiple levels of all of these risk factors impacting our patients, because you have this PM 2.5 that's affecting patients. And then in the summers with worsening heat, we have higher levels of ground level ozone, which is also known as smog. And that's also an irritant that's affecting the upper airway. And so basically what we're doing is we're having like multiple levels of harmful exposures. And if we add the wildfire smoke, particulate matter on top of that, it's just, it's wreaking havoc on the inflammation that people are experiencing. And so again, one of our goals is trying to figure out how do we manage all of this between counseling, pharmacologic therapies, like, personal interventions that we can do, but then also saying, how do we make the outdoors healthy again?
Fascinating. Let's go back just a second. PM 2.5, is that 2.5 micrometers?
Yes, smaller than. Yeah, so less than.
Can you give me an example of what kicks off particulate matter less than 2.5 micrometers?
Yeah, so it's largely from combustion of fossil fuel. So just like gas burning for cars and things like that. So it tends to be higher near highways or major areas of transit. It can also be largely from wildfire smoke as well. So wildfire smoke has both large particulate matter, which can affect more of the upper airway, and the smaller particulate matter too, that gets down into the alveoli and can have more systemic effects.
Any other things that kick off less than 2.5, or is it generally those two are 90% of the etiology?
Yeah, those are the major ones.
Probably industrial, right? There might be industrial kickoffs. Mm-hmm. Fascinating,
yep.
Fascinating. And then Dr. Tummala, you define smog, and you all speak so eloquently and easily about it, but I'm not as educated as you all. Define smog again. You said it's low level ozone.
So smog is also
ground level.
Smog is ground level ozone. And so basically in the summertime, you have the heat that's mixing with like these volatile organic compounds in the air, and that produces the smog, which is also known as ground level ozone. And so this also has a huge inflammatory impact on the airway as well. But one of the concerns is that levels of ground level ozone are increasing in the face of increasing heat. And so, sometimes we try to categorize things. We think about air pollution as one thing, climate change is another thing. But I think a lot of the things that Dr. Dilger and I are talking about today, there's a lot of overlap between those. And a lot of the sources of the poor air quality and a lot of the sources driving climate change are one and the same.
Yeah, I know sometimes my questions might sound ignorant, but I am board certified and I do okay in my MOC. I just, if I have a question, I figure other people might have it as well.
No, that was great. And I actually just wanted to bring up one other small point. We're talking a lot about the upper airway, but some of these air pollutants, the really small ones, there are some that are less than 0.1 microns. Those are the ones that if you've read studies that are talking about the cardiovascular impacts of air quality, the mental health impacts of air quality, the potential link between air pollution and Alzheimer's disease, it's those ultrafine particles that are actually entering into the bloodstream and causing those sequelae and those concerning health impacts as well.
Where do we find those? Same. It's part of the whole milieu from wildfires and combustion. It's just the smaller ones that get through.
Exactly.
Got it. Going back to smog. So I'm in DC. I travel to a lot of cities and I see the smog and I've never really thought about it. I'm like, interesting, looks pretty, it's hot, it's overwhelming, but there are some real otolaryngology impacts.
Yes, definitely. And I think it's also important to keep in mind that the impacts are seen more in areas where there's less protection from green space. So in cities, you see these intra-urban heat islands, which are areas that were historically red lines. So they tend to be divided amongst racial lines and by poverty lines based on old federal housing policies. These areas have a lot less green space, which is protective in terms of reducing ozone because the shade from the trees brings down the heat, so less ozone is produced. So it's definitely contributing to disparities in health outcomes that we see as well, since there's areas that are having higher levels of ozone and smog within the city.
Yeah. I guess microclimates. I've been reading a lot about that, and I bet you we probably see them in mountainous rural regions as well, right? Because you look at the airflow. So an otolaryngologist, help me operationalize this. I need to think about, I think what you're telling me is I need to think holistically about the patient and think about the environmental factors. Is that right when we're thinking about smog in urban areas?
Yes, I think it's important to think about those things in terms of both disease development and then disease management and how patients do with both surgical and non-surgical treatment, since we know it's going to affect, the disease processes we're looking at specifically, but it also exacerbates other comorbidities that we're considering when we're thinking about different treatment modalities.
Excellent point. You both keep grounding me. It's not just office-based, it's post-op recovery, right? I mean, we all know that smoking is bad for post-op recovery. Well, then the environment must have some impact on that. Is there data about that?
We are looking at that right now at my current institution, so we're hoping to have some data on it. But the literature on postoperative outcomes currently right now is limited to general and thoracic surgery, and then there's some data in the transplant literature for, I think, heart and kidney transplant. So in general, patients have worse outcomes for common general surgery procedures. There are higher likelihoods of postoperative infection or need for reoperation, and same for thoracic surgery patients. They have higher rates of postoperative pulmonary complications, things like this, if they have higher air pollution exposure.
Yeah, I could Google this, but you both are like my LLM for sustainability, my large language model. So a HEPA filter, you all talked about that. I think Dr. Tummala, you mentioned you counsel your patients about that. What does a HEPA filter catch? Dr. Dilger, anything more specific than what Dr. Tummala and I counsel our patients on?
I don't think so. I mean, I just know from my own HEPA filter that I have that it comes with different types of filters. Like
Got
there's
it.
an
Okay.
allergen specific one.
Right.
There's I think there's ones with different filter
Okay.
sizes. So I get the indoor air
Sure.
pollution and dog hair one. So
Yeah.
there's different ones for different size pollutants, I think.
Appreciate that. Thank you both. Didn't mean to stretch your knowledge base there. Appreciate staying in the lane. Other things we want to think about or talk about. Talked about head and neck. We talked about allergic rhinitis pollen. We talked about smog in dense urban areas. Other things we should be thinking about.
I think just general access to care is a major one. So we're seeing increasing extreme weather events associated with climate change, and so that can impact access to care. Otolaryngology is a relatively, in some areas, it's already a hard to access specialty because in more rural regions, there's a less dense, there's a smaller number of otolaryngologists. And then if you have extreme weather events causing flooding, causing power outages, this is going to make it even harder for patients to access care. So in New York during Hurricane Sandy, we saw a 3-week delay, at least in care for oncologic surgeries at some of the hospitals. And then I think it also affects the supply chain as well, which we see quite a bit. So the IV fluid shortage last year during Sandy, there were a lot of pharmaceutical shortages. So there's not a ton of redundancy in the supply chain. And so that's something that we need to keep in mind as well.
What's on the horizon? I think I love learning from you all. And last time I asked to bring you back in 6 months. I think maybe this time we'll do 9 months because it looks like the work and field is evolving. What do you see it evolving? Dr. Dilger, you mentioned some studies you're working on. Dr. Tummala, and I don't want you to give away your research or jump the conclusions, but what are you looking at and what should we maybe see coming down the pike?
One of the things that I'm really thinking about is why do we do the things the way that we do them? And is it always necessary? And this is something we talked about last time. And so that's what a lot of my research is focusing on over the next couple of months, is saying, okay, we've always done this surgical procedure this way with this amount of drapes, this amount of gowning. Do we always need those from an infectious standpoint?
Yeah, really, really well said. And I think back to the Joint Commission and those that ask us to peel pack every instrument when we know that it perhaps might not be an impact because we're a clean contaminated case. You walk into a practice, you have 100 peel packs, you see the exhaust from the sterilizer in the office. I mean, complete waste of a cycle there. I don't know if that's where you're going, but I thought of that, Dr. Tummala. So yeah. Dr. Dilger, what are you looking at, you and your team, or what's out there in otolaryngology, in surgery, and medicine at large? Where's this going next?
Yeah, I think the areas that I'm interested in researching are more of kind of the effects of climate change specific to our patient populations and to surgical patients, just in terms terms of optimizing patients for surgery and then helping them get into the best environment for their post-operative outcomes. So that's something I'm interested in looking into. I think it's a very important public health issue, but we just don't have a ton of data specific to our specialty yet. So that's what I'm looking forward to looking into, just to help better figure out, what causes such big disparities in outcomes in our patients.
Yeah, I thank you both for looking directly into our specialty. I know there's stuff in the other bodies of literature, but when you bring it back to our specialty, it really helps and makes us understand what we need to do. Let me give you each the last word. This is your academy. It's your podcast, Voices of Otolaryngology. Dr. Tummala, Dr. Dilger, then I'll end us.
Sounds good. So I'm going to leave us on a little bit of a cliffhanger, maybe a topic we can talk about when we come back in 9 months. So there was a really interesting article in the New England Journal of Medicine Catalyst talking about the impact of AI on healthcare. And so as we are all as clinicians using AI more and more within our day-to-day basis, we also know that AI has a huge carbon footprint. And so thinking about how that carbon footprint may be impacting patients' health and patient health outcomes. And so there's a lot of interesting debate on this in terms of, again, balancing those two things, the benefits of AI, but then also the potential adverse outcomes on health. So it'll be an interesting topic to think about as we continue to realize the full utility of AI in healthcare.
Yeah, I'm a big AI first person personally at the Academy and generally, and I'm excited to hear that. I just want to make sure we don't conflate power usage and energy and say it's directly AI. So it's a cliffhanger, you're right. So let's learn together.
I'll try to end on like a generally positive note, because I think sometimes when we talk about climate change, it looks all doom and gloom. But I think as physicians, we're in a very privileged position to talk with this about this to our patients in a way that's depoliticized, in a way that's about their health. So I think we have a really, really special position in the patient relationship where we can talk about this in a way that's not confrontational, in a way that's not causing a lot of emotions about climate change. It's a way of just bringing the facts to the table so that people are aware and can protect their health.
Yeah, really, really well said. I appreciate both of you. And that's my positive remark. You all are moving our specialty in the field of medicine forward. At the last podcast, if people didn't listen to it, I implore them to go back about 6 months where you talked about what to do in your practice, what to do in your operating room, kind of meso level changes. And today you talked one-on-one. How do we think about our patients? I love that. I have never really inquired. I have obviously about occupational, but a little bit deeper, right? What are their work environment? Really thinking about head and neck cancer, determinants of health, allergic rhinitis and others. So thank you both. This was certainly positive, and I'm thrilled by the contribution you're making to our specialty and for our members. Thank you for joining us on Voices of Otolaryngology. We'll be back in 9 months with you both, right? There's a lot of stuff going on, and we really appreciate you all. Thank you both, Dr. Dilger, Dr. Tummala.
Sounds good. Thank you.
We hope today's episode sparked some fresh ideas. If it resonated with you, please subscribe and share it with friends. Have thoughts or suggestions? Use the feedback form in the show notes. We'd love to hear from you. And don't forget to follow us on social media for highlights, behind-the-scenes content, and updates. Thanks for listening. See you next time.